I had the LASIK procedure done in the summer, Ed. Helps out at the Hustler Club. I can see very, very well when I'm there on Thursday nights.
I'm happy for you, kid.
Yeah.
I had LASIK done as well.
Yeah.
I'm not at the Hustler Club. But more importantly for me, I can see when I'm driving.
Yeah,
now.
well, that's great. And in fact,
I can't see foul balls. But I can see when I'm driving.
Dr. Richard Rothman from LASIK of Nevada sits in right now. Doctor, something special as well, right?
Absolutely. Well, I wanted to say that most of your listeners already know that LASIK is the most successful elective procedure in the history of medicine. Both of you, gentlemen, are testaments to that.
Uh-huh.
A lot of our patients, by the way, do see better at the Hustler Club.
Yes, I
and
would
when
imagine.
they're driving.
Yes.
And the reason it's so popular is because it's so safe, it's so effective. In less than 1 minute per eye, you could be rid of a lifetime of glasses or contact lens wear. But what your listeners probably don't know is that LASIK can now be safer than ever before because of an incredible new screening tool called Avellino DNA LASIK testing. This FDA-cleared process takes about 20 seconds to perform, really fast, really comfortable, and provides the added long-term confidence in LASIK that so many people have been waiting for. The next generation of LASIK Safety is available exclusively at our practice, LASIK of Nevada, and can now provide the extra LASIK safety that your listeners deserve.
That should obviously make people even more comfortable with the procedure, correct?
Absolutely. And the way I like to describe it to my patients is I tell them, you wouldn't drive a car with your eyes closed, so why would you have LASIK without the added confidence and peace of mind that comes from knowing the results of your LASIK DNA testing before you have your LASIK procedure?
Mm-hmm. And so that is new in the world and of LASIK?
It is. We're actually the 6th practice in the United States to have this amazing test available to our patients. We have the exclusive for the state of Nevada, and I'm just delighted because we always want to bring the most advanced technology to our patients, and safety is so important.
Dr. Rothman, you've been doing this so long and so successful, but I'm sure on a daily basis, you have people walking in. It's our eyes, and like Mitch and I, you're always fearful because it's your eyes, and you are. Clay during the break brought up something I did not hear about, that there were major league players who had this procedure done mid-season, which shocked me only because they are so, as we know, concerned about their eyes. It's their livelihood. It's what they do. Talk about now the level of fear you must still see and how you calm them when they do come in and say, this, especially an athlete.
Yes. Well, I've actually treated several athletes that are known people. And, those of us of the male persuasion, we tend to be just a little bit less comfortable with the whole idea of procedures in general. So I like to tell people that I specialize in nervous patients. And I mean that. And Ed, you remember the process. Oh, yeah. We talk before the procedure. I give you kind of an overview of what the procedure is going to be like. We give you a happy pill, which is very important. And then during the procedure, I talk to you through the whole procedure. And that's really important. I don't tell you every last thing I'm doing, but I tell you enough things that you're not going to be surprised by anything. And what I hear at the end of the procedure virtually every time is, gosh, doc, if I knew it was that easy, I would have done it years ago.
Oh, yeah. That's what I get from everybody. And people always ask me, too, well, is it painful? Because I like Ed, and you just pointed out,
nervous.
People are kind of weird about their eyes. I know I was before. And it's like this. It's like, really? You're done already? You got to be kidding me.
It's true. It's less than 1 minute per eye. And I always tell people all you're going to feel is touch, stretch, and a little bit of pressure. In fact, our latest LASIK technology, we're the 6th and 12th practice in the United States to have this brand new technology called Zeiss technology. You literally feel hardly anything at all during the procedure. And there's a brief period in the older technology where the light kind of dims out for a little bit. With this new technology, it never goes away. So it's an amazing thing. It's even better and even more comfortable than it's ever been.
One of the other great things about your company, you're always ahead of the game when you talk about you're the 6th practice to have this technology, but you've always been like that too. You always have the state-of-the-art everything when it comes to the LASIK.
Well, I love the new technology when it provides a benefit to my patients. I don't just get new toys because I like new toys, of course. Who doesn't? But I only get things that provide a better patient experience, more comfort, more safety, and better results. And this new technology is it's off the charts.
How much better is it now than what it was, 10, 15 years ago?
Well, for the average person with an average prescription, it's going to be as good as it always has been.
Sure.
Better vision during the day, and with our wavefront optimized lasers, you actually have better night vision. It's the only laser systems that the FDA allows me to say that. But the people with more complicated prescriptions, maybe people who've been told in the past they weren't a candidate for LASIK, those are the people who really benefit from these new technologies. And, of course, those of us who want the most comfortable procedure with the least amount of feeling, just kind of get me through it, doc. I don't want to feel anything. That's kind of where we almost are right now.
Are you seeing in the past 10 years as people learn more about this and friends get it or family members get it, have the demographics changed? I mean, do you see a lot of older people now? Do you see younger people? Is it all over the map in terms of who walks into your office? And sometimes are you even surprised that a person would come in and say they want the procedure?
Well, it's interesting you said that, because I get asked that question a lot, which is what is the age range of your LASIK patients? And for my practice, it's literally 18 to 81. Now, up until about 4 months ago, I had treated literally one 81-year-old lady, and it was about 10 years ago in Southern California. She was a short, nice lady. I remember her very well, very active. She came in a running suit. Every time she came in my office, I could barely keep up with her. She was really youthful. She was 81. She looked about 61, and she acted about 41. She had the procedure done. She was up and at it the next day. It was wonderful. And just about 4 months ago, I treated my second 81-year-old patient. Same thing, just a very active, vigorous person. And, as long as your eyes are healthy and your vision's well corrected with glasses or contacts, you're probably a candidate for the amazing, life-changing LASIK procedure.
What about nearsighted once repaired? Does farsighted come into play?
It's an interesting question, and it really has to do with turning 40, or as I like to say, celebrating the anniversary of my 39th birthday, which, by the way, I'm celebrating the anniversary of my 49th birthday, but who's counting? The thing is, when you are young, meaning under the age of 40, and you have your vision corrected to faraway vision, like the message said, nearsighted vision correction, that works great. And it could work for your whole life, but most of us, when we get to be 40, we don't want to wear reading glasses. Mm-hmm. So we can actually treat that as well by doing something called monovision, where we actually convert one of those eyes that sees very well at distance, we convert that to an eye that can read at near. And in the near future, we're going to be able to do both. We're going to be able to have eyes that see near and far at the same time, which is really kind of amazing technology. I guess we are in the 21st century.
Wow, that is amazing.
Feels right.
Yeah, absolutely. Thanks so much for coming in today. It's great always learning about the new stuff. Again, Ed and I both had the procedure done, and it's advanced even since then, and I can't recommend it enough.
Thank you so much. I appreciate you having me.
Thanks, Doc.
Yep, there you go.
Thanks, guys.